Okay, so hello, I'm Peter van der Kreeft and I work in the Sleutel in Belgium as head of prevention a long time, since 1987 actually. And since 2 years I'm working in this Kinship Care project as a project responsible for Belgium. And we have had some very nice and important results and experiences in this project for our organization, which counts 180 people. Most of them are working in treatment. And because we were working in the Kinship project, I was of course asking my colleagues in residential treatment or ambulatory treatment questions, where are kinship carers, and most of them were surprised and they started to think, oh yes, that's true, let's ask our family counselor if they work with the kinship carers and if they are there. And actually the project raised quite some awareness in our own expert treatment prevention organization. And this was a very important experience for myself and also for my colleagues, that indeed through this project we became aware that we are actually having contact with a lot of those people.
What would you say are the key things that the carers told you about their experience of being a carer in Belgium?
Yeah. Well, first of all, most carers really have to sort things out themselves. That was very crucial in their remarks. Sort things out on an administrative way, but also on an educational way, like people who have already had problems with their own child and now taking care of this child, going to the parent meetings at school, having to set rules. Now, a lot of people, if they are divorced and a new relationship, also have this problem of I already have educated people and now I have a second generation,
family,
but it's something. It really is something else. And they have this sort of. They reported this sort of a feeling of it is a duty, it is an extra burden, it is actually suffering for me. There's a lot of things that I would like to do more relaxed and more. I would like to have more fun. And now I have to take care of this grandchild of mine, and that makes the relation with the grandchild also not like they wished it to be. And most of all, so these expressions of their feelings or emotions, they really reported quite consistently that they don't have any counselor, any informal groups or services where they can go to. Now, on the other hand, if we approached services and agencies, so
what do you do for kinship carers?
What do you do? What do you need? There are some initiatives going on, very
low key.
Yeah, very low key and very local. Very individual, and depending on one certain counselor who has some interest for this. But first of all, the problem of addicted parents with children as such is not approached in a structural and systematic way. So what would the kinship carers be approached in a structural and sort of a policy-based way?
How have Sleutel approached the resourcing, of this? What have you said? You thought, okay, we've heard what the kinship carers say. We've seen some of these local resources that other people might be putting together on a kind of ad hoc basis. What have you done this year to try and help the situation in Belgium?
Yeah. So after writing all these experiences down in a need assessment report and reflecting on this, we chose to focus on the educational part of this, because several remarks referred to the fact that parents, they felt that they had they had to do to give some extra attention to the educational part of those children who are more vulnerable.
Yeah.
And even if you are not a social worker, you can feel it, that they probably will be more vulnerable for addiction problems themselves. I want to be very sure that they will not get in the same problems. But how to talk about this? How to think about this? And that educational focus we translated that in providing a booklet, a story. We base ourselves on experiences of good practices in Switzerland and in Scotland, where a story of Bobby, it's a small dog who has his boss, a female boss, and he loves her very much. And the story goes about sometimes the boss doesn't, Bobby's boss is not there, or is asleep, or there's something wrong, and there are bottles around, and some medicine, pills around, and then he doesn't know where is my food, and who do I have to play with. The story goes further, focusing on resilience, where the little Bobby dog goes to a friend dog, and they look for a solution. What do I have to do? And very basically, very simply, it comes down to you have to cherish the moments when it is very nice with your little boss. Yeah. And you have to look for yourself with your friends for ways to play, to have fun. And don't just sit there and wonder what is the matter with my boss and when is this going to be solved by itself. Finally, of course, at the end of the very well illustrated book, the story takes about 7-8 minutes to tell, and finally, of course, we come to questions. And you, child, what do you think? What do you think of this? Do you experience this yourself also sometimes? This booklet is a reading booklet for children from quite a wide range, from 3 to 8.
Yep.
And we added a book with instructions to ask more questions, to talk a little bit about this, and also to do some activities do some activities with the child, playing with the ball, trying to find a way how you can cherish a nice moment, how you can take a picture of we like each other, to give suggestions to the kinship carer or maybe the professional who reads the book to a child, to do a little bit more than only read the book and full stop.
Okay, the final question I've got for you, Pierre, is if there was one thing that you could say to your Minister of Health about the experiences that you've had and the experiences that you've learned about from kinship carers over the last 2 years, what do you think that message would be?
Well, for the Minister of Health in Flanders, in Belgium, I would very, very definitely urge him to approach this problem of kinship carers and their grandchildren with addicted parents, to approach this in a structural way, and to first of all to read the assessments, not only from us but also from other institutes, to read the assessments, to recognize the problem, and to design a policy in steps, in year plans, and to admit that this is a problem that you cannot just leave to the services individually, but where a structural approach is necessary.
Brilliant. Thank you very much indeed.